Everyone, thank you for joining us for our webinar today with Riverbend Community Mental Health. We are so excited to have worked on this series with them. This is actually our last of 4 sessions. This whole month we've done 1 session per week. You can actually watch the recordings of the previous sessions on the Chamber's website, concordnhchamber.com. And if you registered for today's session, you will receive a recording of our presentation today. So keep your eye out for that in your email. Today, since you're here live, you get the opportunity to ask questions during the webinar. So to do that, you're going to move your mouse or tap your screen. You'll see a button called Q&A pop up. You'll want to click on that and then simply type in your question. It's anonymous to the other attendees today, so if you submit a question, it's only seen by me and our panelists here today. So please feel free to, comment, send questions, continue the conversation through the Q&A portal. We will answer questions at the end, but feel free to submit them at any time. So at this point, I just want to thank Riverbend Community Mental Health again for supporting us in this series and introduce you to Jamie Corwin. Thank you for presenting today, Jamie.
Hi, thanks for having me. So hi everybody, I'm Jamie Corwin. I'm the Vice President of Human Resources for Riverbend Community Mental Health here in Concord. And it is Mental Health Month, and I am wrapping up the series of webinars that Riverbend has hosted this month with the Chamber. And we all know that employees are our greatest asset. And we know what to do when our employees are faced with physical health challenges. But mental health challenges often feel very different. So this session is going to focus on how to use our HR professionals as a resource to confidently guide us in helping our employees with the support that they might need in navigating those challenges. So, as a brief recap from the last 3 sessions, this slide was shown in week 1. We talked about common conditions, demystifying common mental health conditions such as depression, bipolar disorder, anxiety, substance use disorders, and such. We know that 1 in 5 American adults has a mental illness. We know that mental illnesses are the leading cause of disability across the world. We know that 1 in 10 full-time employees has an addiction. We know that 40% of employees with a mental illness take time off because of it, and that can be up to 10 days a year. We know that 35% or more than 35% of managers feel that they don't receive enough training or support to be able to handle these situations. So these statistics are really staggering, and illnesses don't discriminate. There is definitely equality among physical and mental health conditions. There are 7.2 billion people in the world, and 1 in 5 has a mental health condition, and that equates to about 1.4 billion people in the world that has a mental illness. That's roughly the entire population of Africa, if you want to put it in a geographical perspective. The more we can educate ourselves around mental illness and substance use, the more we can recognize these issues, educate ourselves, we can share resources and support people, and really help to reduce stigma. Stigma was discussed in the second webinar, and stigma is really, really powerful. Stigma has tremendous negative power, and that can really impact people's ability to reach out for help when they need it most. So it's really important that we do better as people to help make stigma go away. People should not feel badly about reaching out for help for a mental health or substance use condition. just like they shouldn't feel badly about reaching out for help if they have cancer or a knee problem. And we talked about person-centered language in the second session. That's really important, that we don't label people because of whatever their illness is, that we use a person-centered approach. I am a person with a substance use disorder. I am a person with depression. I am a person with diabetes. I'm not a substance user, for example. And in week 3, we talked about creating a culture of wellness and how we can work toward helping our folks live well-balanced lives in a more proactive kind of cultural manner. So that's kind of a recap of the first 3 weeks of our series. And then today, we're going to talk about the human resource perspective. So why do mental health issues feel so difficult to navigate? And I have some theories. As an HR professional, I would say that fear is probably the biggest reason why they feel so difficult. It would be fear of not knowing how to address something appropriately, fear of legal issues that may come up because of how we may deal with something, whether it's an ADA issue or maybe an EEO claim or something like that that may come up from how you handle something. Or maybe it's fear of individuals who have mental illness, but fear it tends to be an issue, and why mental health issues feel difficult to navigate. Mental health, some say the subject is seen as taboo. I would say that is a big issue. You know, folks feel uncomfortable talking about it. Stigma still plays a really big part in why folks feel uncomfortable handling mental health topics. And then lack of education and training. And really, quite honestly, I think that the more folks are educated and trained on all the different aspects of mental health and the different types of common conditions that people may experience, the more we understand different conditions and how they impact individuals, the more comfortable we're going to feel in handling any kind of conversation that comes our way. So we're going to talk about training a lot in this session, because those are really the keys to understanding how to move forward and help us with our confidence in handling these situations in the workplace and in the community and in our lives, quite honestly. So it's really true that leaders set the tone in so many ways, right? We all know that it starts at the top and it works the way down. So self-care, we all know, is really, really important. And if we don't take care of ourselves, we can't take care of others. So it is so true that our staff look up to us as leaders of our businesses and our organizations as role models. If we're not making time to take care of ourselves, we're not going to be setting the tone for what we expect of our staff. So we need to be mindful of our own self-care so that we can demonstrate what we expect of our staff. Taking lunch breaks is a really good step in the right direction. And you know what? Some days there may not be time because of whatever, but it's really important to take those breaks during the day. Go for a walk, go for a run, read a book, take a break and do something that is not work related in the middle of the day. It seems like it's a lovely fall day out there right now. This would be a nice day to go for a walk and do something that's not work related at lunchtime. It's not great to have overtime in most business budgets. So if we're trying to get after staff to not work overtime, having them take their lunch breaks is a really good way to do that. But if we're not taking ours, telling them to take theirs is like, well, why should I do it if you're not doing it? So it's really good in a lot of ways. It's fiscally responsible, it's good self-care, and it's everybody feels refreshed when they come back after taking a nice break during the middle of the day. Whether you exercise or do something that's just filling your cup, do something that's good for you, and others will follow. It's really important. Encourage use of earned time. You know, earlier this year, during the early onset of COVID, we started to notice that folks were not using very much of their time off. And I don't blame them, quite honestly, because everything was shut down. There wasn't really anything to do. But if people aren't taking breaks from work, they're just working too much, you know, and that self-care is really important. So even though they may not have really fancy fun things to do with their earned time off, it's still important to take breaks away from work. They may not be able to travel and go to Disney World or Virginia Beach or wherever they might normally want to go on vacation, but they can still take long weekends, and they can still maybe go hiking with their family, or they can, you know, have a long weekend to just finish a book or do something local or carve pumpkins or whatever it is that they're looking to do with their family. But we still need to encourage people to use their time off in planful ways. If they're not using their time off in planful ways, they're going to end up perhaps getting ill and overworking, and then they're going to end up using their time off in non-planful ways, and that's not healthy. So we need to look at how we're encouraging people to use their time in planful ways. Having good check-ins with people. You know, we're all good about, at least I hope, doing our check-ins with our PCP and our dentist, and we get oil changes in our car. How about with our emotional well-being? We need to encourage folks to really have good check-ins with that. There's nothing wrong with having, you know, a check-in with a counselor. If folks feel like they need to have a monthly check-in with a counselor, that's totally okay. Folks can connect with their EAP and have maybe a monthly check-in with a counselor. And there's a lot of folks that do that on a regular basis. But an emotional check-in is a perfectly acceptable way to have a check-in too. We do it with a lot of other things, so there's no reason not to have an emotional check-in too. We need to engage with our staff and build transparency and trust. And that's something that I think we've all done it to some degree with our staff in the past, but it may not feel as natural. But it's so important. It really is. Engagement, especially now with folks being some remote and some in person, we really need to work hard at how we're engaging with people. And we need to build that bridge more so than ever before. And we need to be really transparent with people. They want to know why we're doing things, and they want to understand the reason behind decisions and how we came to those decisions. And that's going to build trust, and that's going to build retention, and that's going to really help develop that relationship with your staff, and that's going to help build this long-lasting relationship for a long time. And that is going to speak volumes for that relationship building with your team. The 5 signs, I hope that Karen talked with folks about that last week, but knowing the 5 signs for changes in mental health is the campaign about looking for poor self-care or changes in attitude or hopelessness. That's for looking for differences in people's presentation so that you know if there's someone who has a change where you can reach out and offer some help or support so that you know when they may need some assistance with their mental health. Those are important for all leaders, and we do have 5 signs like posters and paperwork and things here that we can provide to you. I think there are little rat cards. We have all the information here at Riverbend. So if anyone needs those for their workspace, you can let us know and we can provide those to you. And managers need to be confident in their skills. So we're going to talk more about the different types of skills that we can work on for training your team. So training opportunities. It all starts at the beginning, new employee orientation. What types of training do you have at the beginning for folks? You've probably got things like sexual harassment training and maybe HIPAA training and non-disclosure agreements and safety 101 and OSHA and doing your I-9s and all that kind of stuff. Well, how do you present those to people? Do you say, oh, I'm sure you've done these 427 times before, and it's just, I'm sure it's all the same stuff you've already had before, but you just have to sit through it again, I'm sorry. Or do you say, I realize that this may be repetitive and you've probably done these things before, but I hope that you really sit through this training with a fresh set of eyes. I hope you learn something new. I realize that it probably is not everyone's most favorite topic, but there's really good information in here. We want you to really take this all in and understand that we care about your safety. We care about you understanding our rules for PPE, and COVID is in our community, and you need to understand these particular rules for our environment, and OSHA regulations are very, very important for your safety. Do you explain the trainings and the nature of why they're so important to your workforce and your culture? Do folks understand that? Sexual harassment training, sure, it's very similar in every organization, but do people understand why you take it so seriously? Do people understand the culture? Do they understand why it's important there? If you take that little extra step and explain to folks why it's really important, rather than just throwing a book at them and saying, here, go do that and sign off when you're done, it really does make a difference. And it gives people that extra step of why you care about why you're doing this training. So it really does start at the beginning. And that can go for any kind of training opportunity that you're offering to staff, whether it's a basic safety training, to a COVID training, to an introductory management training, and anything in between. How do you do individual one-on-one supervision or meetings with your staff? In the clinical world at Riverbend, we call it supervision. It tends to be more of a clinical thing in healthcare, but you could call it individual meetings. Or how do you do that? Do you have it weekly? Do you have it bi-weekly, once a month? How do you document it? These are your prime time opportunities to meet with your direct staff and talk about their needs as an individual. Do they need training for their job? Do they need skill development? Is there something that they're looking to do in their career that they need from you? Are there things that you need from them? Are they doing what they're supposed to do in their job? Are you looking for them to improve on certain things? Are there performance issues? Are they absolutely fabulous and you're looking for them to take on something new? This is that time for everything back and forth for those individual people. All of those opportunities for improvement that you see. Talk about clients or customers or whatever it is that you need to talk about with that person. But that one-on-one meeting is your prime time to talk about all of that stuff and make sure that you're documenting all of it very, very well with that person. And ask about them. How are you doing? Tell me about how you are doing. How's your stress level? How's your workload? How's your family? Are you doing okay? Is your workload balanced? How's your client caseload? Is it too much? Is it too little? How's your technology? Is your computer working well? Do you have any needs that I need to be aware of? This is an opportunity for you to have a good back and forth with your staff so you know if there's anything that's keeping them from performing what they need to do. And you can pick up on any of those things. So it's a it's a golden opportunity for that staff and the manager to be meeting on a regular basis. Group soup is what we call this. And sometimes managers actually bring soup to these meetings in pre-COVID times. Group supervision, it's a great time for folks to really talk about things that teams need to talk about. So the topics are usually more diverse There are things like if you're all working on a project, or you share a group of clients or customers, or maybe it's like a whole department of marketing people, you can really talk about things that a group is dealing with. This is meant for group projects to really be talked about. Do you meet once a week? Do you meet once a month? Is it in person? Is it by Zoom? How do you meet? But it's a time when the group can really kind of process and talk about things. And you can do trainings as a group too. But that's another way that you can kind of really process information together if this is a really important group of people. And this can be managers, non-managers, or a mix. But how does that work in your organization? How do you train your leaders? Do you have leadership training that is meant for senior leaders, middle managers, or frontline managers, or maybe for all leaders? What does that look like? Do you train them on interpersonal skills, leadership skills? You could do critical thinking training, or maybe ethical training. Ethics is a big deal. Some people really struggle with certain types of ethics when things are really kind of muddy and they have to make decisions on stuff that are tricky. You could do personality stuff is really interesting. We've done some training here where people learn what personality type they are. Around here it's called the colors training. It's kind of a Myers-Briggs, but some people are really red, meaning like, oh, I have to do it right now kind of thing. And some people are more green, like, oh yeah, I could be really flexible like Gumby, or some people are very yellow, like list makers. Let's put it in my grocery list aisle by aisle kind of thing. Or some people are blue, which means they're very quiet thinkers, like, oh, let me think about that for a couple of days and I'll get back to you. And that's a really interesting training. But there's a lot of different ways you can train leaders, and the training can be really geared toward what level, perhaps. And middle managers is a really interesting one. That particular group of managers here anyway needs a lot of support and a lot of training, because they're getting a lot of stuff from both levels, and they really do need a lot of support. Interpersonal training is definitely huge. Skill development training can come in at any level of the organization and for any type of skill, depending on what your organization is. It could be tech, it could be factory stuff, it could be specific machinery. Around here it would be mostly around like Microsoft Word or Excel, or using the electronic health record or e-prescribing software or certain types of software. But every company might have certain technology that they may need to train on. Safety training. If you have specific things that you need to train on for safety purposes, using certain equipment, any type of safety stuff, safety protocols. Mental health first aid. I would be very remiss if I didn't mention that as a training that was recommended. That is an 8-hour course that can be offered. It has now gone virtual, so you can take it. It is usually an 8-hour course taught in 2 4-hour segments. That is just very recently gone virtual, so I don't know if it's currently doing the 4-hour stints or not. But that is something that we do have 2 trainers on staff who can offer virtual training. I don't know if there's any dates available yet, but there's probably some other sites in New Hampshire that are offering that as well. But that is an excellent course for people who are interested in learning how to assist people in a mental health crisis with helping to de-escalate mental health symptoms. And then Narcan administration training. That is a training you can take online or in person, I think, but online is quick and easy. And that helps you learn how to administer the Narcan nasal spray to someone that you suspect may have overdosed on an opioid. It does not hurt someone if they did not overdose on an opioid, but it may save someone's life if they did, while you're waiting for 911 to arrive. So if you have Narcan in your first aid kits, this is a training you can offer as part of your first aid training or first aid kit, safety training. And these Narcan kits are available through, I know we have them available through our Doorway program for no cost. And it's a very, very quick training, and it teaches you how to administer Narcan if you came across an individual that you suspected of an overdose. So having critical conversations. I think this is probably the toughest kind of thing to learn how to do with folks that you have on staff. The easiest way to really get into having these critical conversations is when you already have regularly scheduled meetings with folks. If you're already having these regularly scheduled one-on-one meetings or supervision meetings, they tend to be much easier to get into critical conversations because you're already kind of in the groove of meeting with people. The content doesn't seem as surprising when you're meeting and discussing things with people on a regular basis, because you're already addressing things on a pretty frequent basis. So none of this should be coming out of left field, unless it's like a sudden issue, I suppose. But if you're meeting really regularly, this shouldn't be a complete surprise when you're talking with folks and having a conversation around these types of topics. When you're going to have a conversation with someone, be planful to the greatest extent that you can be. As an example, I've had many of these conversations. I had someone who was having very, very significant performance problems in the workplace. The performance was obvious memory type issues, failure to meet deadline type things, lots of struggles with paperwork and like all kinds of stuff around performance. What was also very obvious was that the individual was seemingly having some mental health challenges, although they were not coming out and indicating that to us. So what we wanted to do was sit down with the individual first and talk about our concerns around the performance, because those are the things that we knew. We sat down and said, okay, let's talk about the performance. We were very planful. We had to sit down and we planned out writing notes in advance of what we were going to talk about with this person. I wrote down all the different concerns that we had ahead of time, and we talked about, as a leadership group, the manager of this person and myself, what we were going to say and kind of the items we were going to address with the person. And we actually talked about different scenarios of what this person might say back to us, because we wanted to think about what they might come back, different scenarios of, well, they might say this or they might say that. And it's totally fine to work out these different scenarios or practice even, what, if you will, what that person might say, so that you can kind of work out between you how you're going to address it. And is this person going to bring up a potential mental health issue? Maybe, maybe not. We're a mental health agency, so one of the people in the room is a clinician and they suspected that this person may bring something up. Would they or wouldn't they? I don't know. All we can do is address the performance, and then perhaps we will have a different issue to deal with afterward. But all we could do in that moment was address the performance. That's all we had to go on at that time. So be planful and know that you may have other things to address too, but it doesn't hurt to be documenting things and writing out what you're going to talk about. You want to be really direct and specific and really clear with the person. Think about who you're talking to. If you know them really well, think about what learning style, perhaps, if they're someone who might benefit best from having something written out and handed to them to look at while you're talking with them, versus someone who does better listening to you. You may not know that person well enough, so you may want to ask the manager of that person, should I have something written for this person to refer to, versus would they do better talking with us instead? That's kind of an important one. Some people do better with looking at something versus looking at you and talking. So if they might benefit from one style over the other, that's something to consider as well. Be really mindful of both your verbal and your body language and your facial affect, because all of these things speak volumes to individuals when you're having these conversations with folks. So even though your words might be saying one thing, your body and your facial affect might be speaking something else. So you have to be really, really in control of how those are coming off to others when you're in these crucial conversations with staff. We want to be empathetic to people. Empathy is different than sympathy, and we're going to talk about that again in just a minute. But it is true that we want to be empathetic for individuals, especially when we know that they're struggling. We want to look for solutions, try to find options for how we can potentially address the issues that are coming up to us, and be open to questions, because folks generally do have questions that are going to be coming our way. And no matter how much time you might think that this conversation will take, it's either going to be a really, really short one, or it's going to take longer than you think. I've had it go both ways. Some of these are really, really short. Folks just say, yep, 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 and then they leave. And other times they're going to take maybe a half an hour longer than you might think, just because people need time to sort of process and really ask questions. So be mindful of how much time you put in your calendar and give yourself a cushion, because sometimes people really do need that extra bit of time to really sit through and kind of process the information. And if people leave sooner than you think, then you just have a little bit of extra time to process yourself, or maybe with the manager who is perhaps still there with you. So empathy, as promised, we're going to talk about that a little bit. Empathy, I don't know that there's really a right or wrong way to be empathetic. One thing is you have to be a really good listener, and you have to withhold judgment from what you're hearing, which sometimes is really, really hard, but it's such an important thing. You just have to be very, very open and just non-judgmental completely. It's very, very different than sympathy. And I don't know if you're all familiar with Brene Brown, but I think I'd like to be her when I grow up someday. I'm gonna just switch over to a really, really short video where she talks about empathy versus sympathy, which I think it's like 2 minutes. And it's just a really, really good video that shows you the difference on empathy versus sympathy. And I think it explains it better than I could.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, You want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with "at least." I had it, yeah. And we do it all the time, because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So I had a miscarriage. At least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, "I don't even know what to say right now. I'm just so glad you told me." Because the truth is, rarely can a response make something better. What makes something better is connection.
So I know that that's not always going to work in HR, but I do know that sometimes people come to me and they just need to tell me something. And I am not a social worker, but occasionally I feel like I play one at work. And sometimes people just need an ear. They just need to come and say, "Jamie, you know what? This is going on, and I don't know what to do, but I just need to sit down, and I have something I just need to get off my chest, and I just need to talk to somebody." And they come in and they sit down and we talk, and sometimes we'll go get a coffee or whatever, and we just talk. And it doesn't have anything to do with their work sometimes, and sometimes it does. But whatever it is that's going on in their life, it can impact their work because it's significant and it's important to them, and in that moment, it's important to me. So empathy, it can be really important, and I do what I can to make time for people. If I'm going to be their person in that moment in time, I do what I can to make time and listen, because they may not have another person to listen for them that moment in time. So empathy can be really, really important. It's a way to build a bridge with folks if they're reaching out to you in that moment. So relationship development with staff, we know that it's not the same as with a spouse or partner or a kiddo or a family member, but it's still really important. We want to build relationships with our staff, and we want to nurture those relationships, and we want to get to know our folks, and you know, how far do they commute, and what's their family like, and when's their birthday, and like, how long have they been there? Have they been there 20 years? And do you remember Administrative Assistant Day? I'm really bad at that. How about Boss's Day and IT Professionals Day and Nurses Day and that kind of thing? Check in when you know things are going on at home, like are they going through a renovation, or did their mother-in-law just move in, or is one of their family members going through a tough time, or did they recently lose a pet, or you know, things like that. If you are aware of those things, going in, checking in on those things, it really, really makes such a huge difference for folks, and it just shows you care. It's really important. Fostering career growth and development, whether it's in your department or not, is a really, really important thing. I have had so many folks come and go from my department over the years, and it always hurts to see people move on and go on to other things, whether it's in the agency or outside. But knowing that I was part of helping them to grow and move on to something that was really important to them is great. And we still keep in touch. And knowing that they were able to grow in their career is really important. And I think that that helps to build a bridge too. And it really does help to nurture that relationship with your staff, knowing that you care about what they're interested in doing in the long haul. Even though you know that they won't stay with you forever, it really does help to build and develop that relationship. And it might help them to stay with you longer than they might otherwise. So that's something to think about too. So things we can do to help folks during this unique time. I love the word unique. It can really fit into a lot of places. Check on workloads. It's a good time to make sure that workloads are really appropriate and well balanced. It's a good time to do check-ins, really as much or as often as you think are appropriate. It's a good time to celebrate employee successes, even the little things. You know, anytime you can celebrate a success of someone, it's going to help to increase morale and decrease stress level. Are you doing anything for Halloween this week? I imagine that having a work from home / in the office mask costume party, or I mean, who knows what, will be a wonderful idea if you have people, or maybe a best dressed pet or kids costume, or who knows what. But you could probably do something fun this week, and staff will enjoy that. Anything you can do to celebrate folks and give them something to look forward to, because this is just such an unusual time that we're all going through right now. We need to encourage positive life balance. I took work out of that. It used to say work-life balance. I don't know that there is such a thing anymore. I'm thinking it's just life balance at this point. We just all need to have a positive life balance at this point in time. We need to encourage folks to have a good, solid expectation of what their working hours and productivity expectations are. With the remote opportunities that we have now for people, I'm willing to bet that people are working more hours than we might think that they are, because they're not commuting anymore. They're probably logging on at 7 in the morning and working until 6 at night because they're not commuting. And you know, that's a lot. That's a lot of hours. So we need to really be clear on what we're expecting of people, and let them know that they might be working harder than they need to be during this time. We don't need folks to be doing more than they need to be. We need to remember that flexibility is really important. I don't think that's news to anybody, but remember that not everybody thrives in a work from home environment. Not everybody thrives in a hybrid. Not everybody thrives in the office. You know, there's no one size fits all situation that works for everybody. Just like with kids, you know, not all kids really love the whole 5 days a week in school. Not all kids love being remote, and not all kids like the hybrid. There is no perfect way to do this. So just remember that there's a lot of folks that are just kind of trying to find their place in what works best for them. And try not to give out busy work. There may be some places where that's appropriate, but keep that to a minimum if you can, just because it's just going to add stress. And we certainly don't want to do that. We want to prevent any kind of extra burden on folks if we can avoid it. So some ideas around benefits. Think about how you promote your benefits, especially the mental health ones, and how you might do it differently. Do you educate people one-on-one? Do you do video educations? Do you maybe do live videos? Do you do recorded videos? Do you do like open Zoom hours where people can log on and just ask questions about benefits? Do you do like phone conference stuff? How do you do benefit education? That kind of thing, especially around benefit open enrollment time, might be a good opportunity to figure out how you might be able to do some personalized education sessions for people so that they could ask questions more one-on-one of people in your company rather than having them go out to like a broker or something. They might feel more comfortable asking folks that are in your company. Can you utilize your intranet or maybe some email blasts to focus on things like mail order prescriptions or telehealth visits or urgent care centers to lessen people going to the pharmacy or the doctor's offices for things like, medications, because that'll lessen for COVID transmission purposes if they're using mail order versus in-person pharmacy, telehealth versus in-person visits. And then for urgent care, I know there are like COVID hotlines that people can call so that they could get information versus going in person. It might save a trip, which would also be less costly. Just some information there in case you want to look into that with your broker or benefit provider. COVID-19 testing, treatment, and coverage information. I know our broker's been really helpful with providing a lot of stuff to us in layman's terms because some of it can be really confusing for folks. So that's stuff that we've been putting out for people in really short blasts so that they're not inundated. But that's been good information for people to have, especially with uptick lately in Merrimack County, that we've been putting that out in little blasts here and there. There's been changes this year with flex accounts and retirement plans relative to the CARES Act and different things. So making sure that that information has gone out to people if you've made changes. And different wellness activities and benefit education, like we talked about before. Employee handbook, policies, and procedures. So these are things that I thought of that you might be able to kind of take a look at your handbook and such to see if any of these might need some work or some tune-ups. How does your ADA accommodation section of your handbook or your policy manual look? Do people know how to pursue an ADA accommodation should they need one? How does your HR system flow? What does that procedure look like when people might need an ADA accommodation? Does it flow nicely? Is it clunky? Does it need an overhaul? Do you have a standard form that people fill out for that? What does that look like? Drug testing. With drug testing, what does your policy look like on that? Are you a recovery-friendly workplace? Some people are on medications, whether it's a psych medication or something else, that may show up as a positive screen on a drug testing panel. How is that addressed in your drug testing policy, if you have one? Some people take medications for like ADHD or something where they have to have a medication with them at work. How is that type of policy addressed in your workplace? So that type of policy. Background checks. Depending upon your procedure, how does your system address criminal charges? Are you a recovery-friendly workplace? Again, do you have a policy against having people with a criminal record? Someone may be living in recovery and have had a charge relative to a substance that may be from when they were not in recovery. So how would that affect them now that they are in recovery? And what would that look like at your workplace? So that could inadvertently, a policy that was too strict around criminal charges could impact someone who was living in recovery at this time. So what does that policy look like at your workplace? How about your time off policies or leaves of absence? What do those look like at your organization? How about service animals? Does your company know the 2 questions that you're allowed to ask of both an employee and of a guest, customer, patient, or visitor, of what you're allowed to ask of someone who comes with a service animal? You're allowed to ask, is this a service animal for a disability that you have And what is the service animal trained to do for you? Those are the only two questions that you're allowed to ask about the person's service animal. And a service animal can be either a dog or a miniature horse. There's no other type of animal that would meet the guidance for a service animal. And they don't have to necessarily be wearing a vest or some other type of marking to identify them as a service animal. So do you have appropriate information in your handbook identifying that, and do all your staff know what they can and can't ask about service animals? What's your no-call, no-show policy? This is a tricky one because if you have, for example, if you don't call and you don't show one day, I can give you an example about this. We had someone who was a no-call, no-show for one day, and we couldn't reach them. And we called their emergency person. And their emergency person said, gee, I don't know what happened. I saw them this morning. And my mind goes to, my gosh, car accident, kidnapping, or they just took off. I don't know. But our handbook says 3 days of a no-call, no-show is considered a resignation. This particular situation ended up being a person had a substance use problem, and it ended up being like a medical leave situation. But if you have a 1 day no call, no show issue, that could be a really dicey situation, especially if it's a medical complication. So just be careful and look at that language to see how your no call, no show might be written. Emergency contacts, do you have them? When do you use them? How quickly do you call someone's emergency contact? Because it doesn't take me long to call an emergency contact if I can't reach someone. And how about wellness checks? Do you know how to do a wellness check? Call the police department and do a safety check on someone. If we can't get a hold of a staff person and their emergency person can't either, or we can't get a hold of an emergency person, we'll call the police and do a safety check. So do you know how to do that, and when do you do that? So those are all things that are pretty important to know. And then getting toward the end here, just thinking about mental health questions that come to HR or managers. The equality of conversations. It's really important that if a staff person comes to you and says, hey, I need to have a hip replacement, or I need to go to detox, that you handle the conversation the same way. There is equality of conversations, physical health versus mental health. You handle it the same way. If performance is problematic, you address the performance. Don't make assumptions about what the reasons are behind the performance problem. Generally, during like corrective action meetings and stuff like that, staff are asked if there's accommodations that we could make that would help them perform the essential functions of their job, and that will open the door, if necessary, to talk about accommodations. Equality of time off. FMLA, ADA, disability claims, handle those the same as you would for physical health. Mental health is the same way. And if you send flowers or cards to your staff who are out on leave for physical health reasons, you should also do that if they're out for mental health reasons. Again, equality of leave and equality of illnesses. So for COVID stuff, we need to pay more attention to folks than ever before. We need to really be ready for sudden events, because as we know that COVID trending is happening all the time. They're going to pop up more frequently. Businesses are going to need to pivot at any moment. These are just things that are going to happen. So it's something that we all need to be prepared for. We need to make sure, I love this bullet, make sure that office gossip and fake news doesn't take over. What I mean by that is we need to be as transparent as possible while following privacy rules of whatever the situation is. You know, thinking about if you have a staff member who tests positive and that kind of thing. There's going to be issues that come up between staff who wonder about why people's work situations have changed and why that is and why they don't know about it and all that stuff. People are going to fill in the blanks with whatever they want to fill in the blanks about if they don't know the details. But that's just kind of the world we live in right now. In any case, once people understand some of people's personal situations, they'll begin to understand better why we as business leaders are making decisions about what we have made decisions about. But with COVID-19 and contact tracing and all of the stuff that's happening, DHHS and public health are going to be giving businesses guidance on who to tell what. And we're only going to be allowed to tell people who are involved in the contact tracing certain information. So it's going to be really tough for certain businesses as we navigate those processes. I'm just kind of letting you all know, because I've been through this a few times, that office gossip and fake news is kind of going to be challenging. Be transparent as much as we can be, and be open about any decisions that you make, again, as much as you can be. So in the end, it's okay if you don't know what to say to people. It's okay to ask. These are just ideas of things I thought about. Like, you're not going to know what to say to everybody. You're not going to have the information all the time. How can I support you? What can I do to help you? Have you thought about the EAP? Is there anything we as an employer can do for you? Is there anything I can do for you as a manager? Is there any benefits that can help you? Like, you're not going to have all the answers all the time. There's just no way to have 100% preparation for every situation that might happen. You can validate, you can normalize, be confident, be open, be a good listener, all of those things. Offer to get a cup of coffee with people, offer to go somewhere else with someone. All of those things are fine, but there's no way to do 100%. Have all the answers all the time. It's just not possible. And then when you need to lean on your HR team, if you see a situation that's concerning, you have a discussion you need to be consistent using the EAP. I kind of bombed through that last one because I know I only have 2 minutes. I'm really, really sorry that I'm kind of ending really quickly here, but I wanted to make sure we had like 2 minutes at the end to talk to the folks that might have a question and for Emily to hop on.
Yeah, so I don't see a question here right at the moment, but if you would like to submit one, just move your mouse or tap your screen, click on Q&A and type a question, and it'll only be seen by us, so ask away. I do have one question for you, Jamie, maybe to kick off the conversation a little bit. So you gave this great example about sitting down with an employee and having a conversation with them about performance. But I guess my question is, how can you, because you can only talk about performance, how do you have that conversation about performance, especially if, again, you have that piece of paper? If some people do better with a piece of paper, how do you do that without seeming like you're attacking? How do you be mindful in that kind of conversation?
Well, when it comes up with performance, I generally have a plan that is listed that shows. I'm looking for the slide at the same time that this person wanted to.
Yeah, we got another question in. Can you please show the slide again that listed how we can be leaders and show up for our employees? The slide that talks about self-care, time off, etc. I think that was way at the beginning. So
it was at the beginning. So I'm trying to click back at the same time.
We're getting there.
Okay. So usually when I'm going into a meeting with someone about performance, I've kind of outlined with people in mind what the performance issues are on paper. I've worked with their manager in advance to kind of outline what we see as the performance issues from our perspective. And then we might come up with a draft of what we see as the potential ways to address it. Like, let's look at some training of this, 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 and this. And then we would kind of outline what our ideas are so that we have it kind of mapped out from our perspective. And then we would open up the conversation with the employee and say, okay, these are the things that we're seeing as problematic from our perspective. This is, again, just our perspective. What are your thoughts on this? And then these are the things that we're thinking might be helpful for you. What do you think might be helpful? And then have this discussion back and forth about how we might make a plan for success.
Okay, great. I love how solutions are part of that. That makes so much sense.
Yeah, it's
great
like,
advice.
okay, well, this type of paperwork document or whatever is, it looks like this is not being completed correctly. So we'd like to look at doing this training again. What are your thoughts on that? Do you feel like you're doing it properly? Because it doesn't look like you are. So how about we look at redoing this training? You know, it's not like an attack. It's more about, this is what we're seeing. This is what we're offering as a solution. Do you think that's adequate? Do you think this training method works well for you? Would you rather do it a different way? I mean, I think the learning style is a big topic because not everybody learns well from like classroom, you know, and really understanding people's learning style. Are they a better learner from observing? Are they a better learner from doing? What's the better way to go? And we've learned a lot over the last couple of years that learning style has a big impact on how people really do better.
Yeah, great. Wonderful perspective. All right, so I know it's 2:02. I'm just going to take over the screen for a quick moment, share some chamber news with you all. So tomorrow we're going to hold this webinar with New Hampshire SBDC. It's an overview of the Main Street Relief Program 2.0. If you are interested in applying for this program, the deadline is this Friday at 4 p.m. So if you have questions on that program, what that funding might look like for your business, I highly recommend you attend this webinar. You can register, find more information all at concordnhchamber.com. Couple other things coming up. We have a virtual networking event. If you haven't tried this before, I highly recommend you check it out. And then, of course, our Pinnacle Awards is coming up in November, so you can learn more about that on our website as well. So again, thank you all for coming. Thank you so much, Jamie, for this great presentation. And yeah, I'm excited we've got this recorded so we can continue to share it with everyone.
All right.
All right, thank you.
Bye.